And now I want everyone to take a look at an interview I had a couple days ago with Dr. Brian McNeil about racial disparities in the treatment of prostate cancer. Despite great strides in prostate cancer care over the past several years, racial disparities in care exist. Black and Hispanic men have a higher burden of prostate cancer mortality. So joining us to discuss this and more is the Vice Chair for the Department of Urology at Sunny Downs State Health Sciences University, Dr. Brian K. McNeil. Hi, Dr. McNeil. Thank you so much for being here.
Good morning, Ashley.
Good morning. How are you?
I'm good. It's a pleasure to be here with you.
Yes. Now, Dr. McNeil, tell me, what has research discovered about racial disparities among men with prostate cancer?
Racial disparities do exist. If you look at the risk of prostate cancer, if you're the average man, your risk of developing prostate cancer is maybe 1 in 8. If you're African American, it's 1 in 6. 20% of all new cancer diagnoses in Hispanic men are prostate cancer. And if you have a family history of prostate cancer, your risk is even higher. And what research has told us is that there are genetic differences amongst various ethnic groups which contribute not only to your risk of developing prostate cancer, but also to how you respond to therapy.
Now, is there a racial disparity in the utilization of new therapies for advanced prostate cancer?
Unfortunately, there is. We recently looked at immunotherapy and its introduction a little over a decade ago for the management of prostate cancer. And what we noted was increased adoption of immunotherapy in white men as compared to black men. And we don't exactly know why. I'm not sure if it's a matter of educating patients about their options, or if it's a function of lack of access to care.
Now, I'm wondering, has COVID-19 and the location for where some people live affected their treatment options?
It absolutely have, and in order to understand that, we should look at resources and how much we've sort of shifted our healthcare resources towards the management of the coronavirus pandemic. Urban areas that serve, urban hospitals that serve black and brown people have been hit especially hard by the coronavirus pandemic, and this has led some men who were surgical candidates not to have access to surgery at the height of the pandemic.
Now, when should men get screened for prostate cancer?
If you're a man at what we consider to be average risk, you should engage in a conversation with your physician about prostate cancer if you're between the ages of 55 and 69. It's something that we refer to as shared decision making. If you're a part of a higher risk group, you should consider having that conversation earlier on. And you're part of a higher risk group if you're African American, if you have a family history of prostate cancer, or if you have a family history of other malignancies. For example, breast cancer, ovarian cancer, or even pancreatic cancer.
That was going to be my next question, because I know as a woman, if breast cancer runs in your family, they do suggest that you get checked, sooner rather than later. And it seems like that, rule still goes for men getting checked for prostate cancer.
Absolutely.
Now, can you tell everyone out there where they can go for more information?
Of course. Please go to the Urology Care Foundation website, urologyhealth.org. There's lots of great information there.
Dr. McNeil, thank you so much for being here. I really appreciate it.
You're welcome. Take care.
Thank you. Everyone, stay right there because we got more Good Day Live when we get back.